My name is Sydney Grant. I am the co-host of our podcast, Rural Health Leadership Radio, and I'm excited to welcome you to this short presentation on bridging the rural connection gap. So for some background on this podcast, my colleague and co-host, Dr. Bill Oxier, created Rural Health Leadership Radio as a free, simple way to connect people from all across rural healthcare. So each week we have a new guest that comes on to share their story, best practices, lessons learned, resources, and much, much more, all specific to rural healthcare. And these are guests from all across the spectrum of rural healthcare, industry, academia, administration, research, and everything in between. But again, all rural specific. So the mission here at Rural Health Leadership Radio is to improve the world by engaging rural health leaders in conversations, learning, and research. And we have been on the air now for 7 years. I joined as an intern back in 2018 and have come microphone side and joined as a co-host this past year. To get a little bit deeper into the why of our podcast and what we do, we know that rural healthcare faces a lot of issues and obstacles. Particularly the closure of rural hospitals was what inspired Bill to create this podcast to share best practices and resources that might help keep other rural facilities open. So he reached out to some rural hospital CEOs from all across Florida. We're both Florida based, and was asking about the issues they were facing. And he was inspired when one CEO told him that he felt like administrators kept secrets. There was no way of sharing what did or didn't work for people. And he wished there was a free, simple way to share best practices and knowledge in rural healthcare. So with that in mind, we thought this podcast would be a great way to be the tide that raises all ships, so to speak, by sharing these stories, resources, and knowledge that may have worked for one person so that others can learn from it and in turn overcome some of that isolation that we see so often in rural. So like I just mentioned on that previous slide, isolation, we know in rural America, there can be a huge sense of this isolation, not just geographically, but emotionally too. And so that was something we also wanted to overcome with this podcast, was the great disconnection, as Bill and I call it. So we know inherently no one wants to be separated from the herd. Everybody wants to feel included and like they're a part of a community, but that can be difficult when you're physically distant from people. So we know there are also negative impacts that come along with that isolation and disconnected feeling. And so through our podcast, not only are we able to share these resources and key pieces of information that can help people, but we also create a community for those rural healthcare professionals, really anybody living in rural America, to connect. So a great opportunity to not just provide knowledge and resources that can be a huge benefit that people may have not known were available otherwise, but also providing an opportunity for connection on a deeper level. And so by creating this wonderful community of like-minded individuals, we're able to connect ideas and people that may have never been connected otherwise. And it's been incredible to see how the experiences and stories shared through this podcast can make such a difference. So as we grow, there's more to offer. The more our community grows, the more information and resources and knowledge there is to share to improve healthcare in rural America. So here at Rural Health Leadership Radio, we will continue to share the information and stories that can help those in rural healthcare. We'll keep working to reduce isolation by providing this community and continuing to showcase the value and diversity that exists so strongly in rural America.